I'm Dr. Rao. I wanted to talk to you today about the differences between a traditional visit at a traditional doctor's office and a usual visit at Shakthi. Most common reasons why people visit their doctors in women are for skin disorders, joint pains, arthritis, back problems, and lipid issues. For men, it is usually related to cardiovascular risk factors such as lipid metabolism, blood pressure issues, or for diabetes. But as a background, as an internist, I see a lot underneath the chief complaints of what people come in for: fatigue, an overwhelming sense of tiredness that is above and beyond what is expected for the level of activity the person's going through, weight gain issues over a few years, which tend to creep up on people 5, 15, 10, 15 pounds over time, and a level of unhappiness that just doesn't give people great quality days. Uh, this patient that had come in had a history of seeing traditional doctors for polycystic ovary syndrome, which is a hormone imbalance in women that is associated with insulin resistance. She's a 28-year-old female. She had increased weight gain, she had acne, irregular cycles, increased sugar cravings, and a very low mood when she came in to see her doctor. She was placed on doxycycline for her acne, which is an antibiotic, birth control for her irregular cycles, and metformin for sugar issues. And she was told to diet and exercise. Now, mind you, none of this is considered abnormal. This was all standard of care. It's treating each symptom uh, with a pill, so nothing was really done wrong. However, as a result, from the doxycycline, she had changes in her gut bacteria, and she presented again to her doctor with diarrhea. She got started on Imodium, which then turned it into constipation for her. Birth control wound up giving her fluid retention, and she was started on a water pill. The water pill got rid of her water, but it started to elevate her sugar as a side effect and worsened her diabetic control. The birth control also depleted her B vitamins, which made her mood worse, and then she received Zoloft, which is an antidepressant. She was also told to diet and exercise, but not really given much in terms of details about that. Her medications she wound up leaving with was doxycycline, Imodium, oral contraceptives, metformin for her sugar, Zoloft for her mood, and a water pill for her fluid retention. But I will tell you that she did not feel any better from these treatments, and if anything, she may have felt worse. At Shakthi, we look at the same patient a little differently. We look at the root problem, which is the insulin resistance. We often start with the gut by changing the diet, eliminating foods that are inflammatory for the body, and adding back foods that grow good bacteria. We increased her plant-based proteins. We talked about concepts of intermittent fasting, which helps with insulin resistance. We worked on increasing her muscle mass with yoga and Pilates. We work a lot with stress, and we taught her how to do breathing techniques for her mood and promoted sleep. And we did acupuncture for her for hormone management. And as a result of these techniques, she started to gain more energy, slept better, and she had energy to do some exercise, and we put her on an exercise regimen. So at Shakthi, we look at the patient through different eyes. We don't use Band-Aids for symptoms. We look for root cause. If this is something you think we can help you with, please call us.